on Spring Television. Ours it is.
Hello viewers, good afternoon and welcome to your darling program, Spring Clinic. It's an avenue through which we discuss various issues, happenings concerning your health. The popular saying is that health is wealth, and it is a template through which we discuss with medical practitioners issues that have to do with medical consultations, problems in the healthcare industry, and of course, what we can do to be able to make it more meaningful and more effective. This afternoon, we're going to be discussing a very important topic. We scratched it on the surface last week. Yes, I am your regular anchor program here. I am Dr. Adeoye Oyewole. Last week we discussed something and then we scratched it on the surface, and it has to do with the issue of violence against medical workers in the hospital. It's becoming recurrent. As at the time we were having that program, an incident has happened somewhere in Delta State, of which we are going to have an extensive discussion this afternoon. And of course, that has also necessitated the fact that I have had to bring somebody who is not just a doctor in the teaching hospital, is a consultant, an aesthetist. He's also a lecturer in the College of Medicine in Osun University here. And of course, he's also a past member of ESCO of NMA in Osun State. He has also played active roles in the Association of Resident Doctors. That means before he even finished as a consultant. I have the privilege of bringing on board this afternoon Dr. Eri Folami. You're welcome, sir.
Thank you very much, sir.
Please, I think, tell the people briefly about you so before we start discussion.
Thank you very much, viewers at home. I'm Dr. Folami Emmanuel Oladayo. I'm a consultant and aesthetist with Osun Teaching Hospital, a former president of Association Resident Doctor Osun Teaching Hospital, and immediate past secretary of Osun Nigeria Medical Association. Thank you.
Yeah, thanks for having you, sir. I think you are well qualified for this discussion this afternoon because violence against medical doctors is something that is scary. It's scary because the Nigeria itself as a country is bleeding from the exodus of our doctors from Nigeria to overseas country. As a matter of fact, for us as psychiatrists, I'm a consultant psychiatrist. We used to have 300,000 psychiatrists, and I think it has gone down as low as 150. So when we keep having doctors graduating, and the next thing is that they are getting out of the country, it's scary. It's scary to us practitioners. I also want to believe that government too is worried about this. But much more worrisome is the fact that those who now prefer to stay back, which is at so much sacrifice and service to humanity. And then we have these cases of violence against them. It becomes something that should be addressed. It's worrisome to anybody, more importantly to us as doctors. And that's why I brought Dr. Eri Folami. Now, Dr. Eri Folami,
yes, sir.
What do you think has happened? Because I think doctors in those days, even before some of us were born or when we were young, we hear of stories of Western region that if the Governor General is going on leave, the most senior doctor takes over. That's how prestigious medical practice, medical doctors were in those days. What do you think is actually responsible for this spate of violence against medical doctors or medical workers, generally speaking?
Thank you very much, sir. Thank you, viewers at home. Well, my opinion is that most of the time, the people doesn't even realize the tension of a doctor. Because for me, for somebody determined to be a medical doctor, is a big sacrifice. A lot of issues. Sometimes the new doctors they're not aware of what awaits them. NARD, which is National Association of Resident Doctors, did a survey last year, 2022, and they realized that this violence is almost once per day. They got that there are 345 cases only in 2022.
Wow, violence against doctors.
Against doctors. 345 in only 2022. Meaning that sometimes the environment they are discussing salary, they are saying they aren't earning much. Even the people they are waiting to stay will not even mind to kill them at every opportunity. Not even looking at what is the reason for it. There are a lot of cases for which they are going to raise up eyebrow on these doctors. So many issues that doesn't even concern them. Just imagine somebody who was careless and there was a issue of poisoning of a pediatric patient who you did not even present on time. You gave palm oil. You are presenting in the hospital 7 hours after you have poisoned your child in a way, and suddenly you came to hospital within 2 hours. The baby died. Yeah. It is the fault of the doctor.
But why is it that is it a recent thing, or has it always been? And if it is recent, what do you think, in your own opinion, is responsible for this spike in the incidence of violence against medical workers?
Thank you very much, sir. I wouldn't say it's just that at least in this recent time is becoming more rampant than what it used to be. Recently, I think the issue now, major issue is because sometimes the waiting time in the hospital had increased because so many doctors had left. The duty of 100 doctors had become that of one. So doctors also will not rest. You have to see a lot of patients. They don't want to wait.
The time you need to wait before you see doctor is increased. Yeah, and the people in the society will not take
it. They want to enter hospital. They want to see doctors. They will tell you that's the reason why you are here. Apparently. That's the reason why you are paid. You have to see me. Not even considering what you are doing as of present.
I get that.
You want to see me? I'm in theater. Yeah. This is somebody dying. I have to bring out this baby. Wait for 20 minutes. Say no, 20 minutes is too much. It's a matter of life and death. I agreed. But the truth is, even for the doctors too, he has to also attend to people and take time.
Apart from the fact that he's overworked.
Apart from being overworked, apart from the workload, whether he likes it. Some of us are even on drug to see patients. We have to keep ourselves alive. To continue to move on to see. When you have to operate at 8, at 9, at 10 p.m. There's no how you'll be able to do this without being on one form of drug or the other to be able sometimes stimulant. Sometimes you have to take Nescafe to just be awake because you want to take care of somebody who will decide to beat you in the next 2 hours. Yeah. Because it's feeling that you're not doing enough.
Now this beating, can we be a little more specific? Will it be just something that is a figment of the imagination of doctors? I mean, you just quoted some figures. That's supposed to be an academic publication. Yeah. You have some certain vivid examples.
Yeah, there are a lot of
to bring the point home.
Thank you very much, sir. There are a lot of there are a lot of publications on this. At least in the recent past, a lot of this. But in practical sense of it, I've had calls to rescue 1 or 2. We have to rush at 10 MA level. We have to rush to a nearby teaching hospital where members were beaten mercilessly. Why were they beaten? We are trying to do hemodialysis for a patient.
Trying to use a machine to clean the blood.
To clean the blood from the patient.
Yes, please.
Now, in an attempt to be able to secure this line to do this, they have to remove the pubic hair.
Yeah.
Now, eventually the patient died and the relative came, not meeting the pubic hair on the woman.
And they
felt was
maybe the doctors are
ritual or whatever. Somebody of the from them, and before they even talk to anybody, they started beating up the doctors. They were admitted in the hospital for almost 2-3 days.
That's serious.
The doctors. So it wasn't that we were there to see what happened there because we were called from Elimileba. And when we got there, I think there were pathologists. It was a mess. So we have there was one recent case. I think it was at Abeokuta.
Yeah.
The father and the son beat up the doctor because they were terribly angry. They felt one of the family member died because of one disease or the other, and they felt was the negligence of the
we understand that you doctors have been paid huge amount of money as hazard. I don't know whether this hazard has been computed into whatever they are paying you. I don't know whether you have an idea of how much you are being paid to. Or maybe when they were contemplating hazard payments, maybe they put into consideration the fact that you can be beaten up.
Thank you very much, sir. I want to say categorically, sir, that there is no job as Asadios has been a medical doctor.
Now?
As it stands now. I'm going to give you analysis. why I said so. Most times, communicable disease, the time of Ebola,
COVID.
the times of COVID, how many? It's COVID majorly. How many of our people were able to come out to face what is happening? COVID. But whether you like